Hello, everyone. I'm Dr. David Thompson. Before we dive into the science, I want to tell you about a patient of mine named Margaret. Margaret was 67 years old, living in a quiet suburb in Florida. When she first came to see me, she wasn't walking, she was shuffling. Her husband had to help her out of the car. Her orthopedic surgeon had told her that her knees were bone on bone, and that a total knee replacement was her only path forward. She was terrified. She had seen friends go through that surgery, the months of grueling rehab, the risk of blood clots, and the fear that she would never truly be herself again. Margaret was at a breaking point. She told me, "Doctor, if I can't walk to the mailbox, I might as well move into a nursing home." But today, Margaret is not in a nursing home. Last month, she sent me a photo from the top of a trail in the Blue Ridge Mountains. She didn't have a surgery. She didn't take high-dose steroids or addictive painkillers. The secret to Margaret's recovery was a simple, natural method that 97% of doctors usually overlook. You see, most of my colleagues are trained to fix the hardware once it breaks. They treat your knee like a rusted hinge on a door that needs to be replaced. But your body isn't a door. It is a living, breathing biological system that has an incredible capacity to regenerate if you give it the right tools. In this video, I'm going to show you exactly how Margaret saved her cartilage. I'm going to guide you through the implementation of a specific nutritional protocol that can help you avoid the operating table and reclaim your independence. But before we start, I want to make sure I'm speaking to the right people. If you are watching this, I want you to stop for a second. Go down to the comments right now and type in your age and your most frustrating symptom. Is it a grinding sound when you take the stairs? Is it stiffness after sitting at your desk for an hour? I want to see who is here. Are you an office worker in your 40s? A new mother dealing with postpartum joint pain? Or are you over 50 and feeling like your body is betraying you? I want to tell you something very important. That pain you're feeling? It isn't just bad genetics. It isn't just part of getting old. In my 30 years of practice, I found that most joint degradation is actually caused by a deficiency in 4 specific, critical nutrients that your cartilage is starving for. Today, we are going to end that starvation. For those who are new to the channel, welcome. I'm Dr. David Thompson. My mission here is simple: to help you live a life that is healthy, vibrant, and, most importantly, independent through the power of scientific nutrition. I've spent over 3 decades in the trenches of medicine. I've seen thousands of patients who were told their only options were pills or procedures. I'm here to tell you there is a third way. We use peer-reviewed science to unlock the healing power already inside you. Before we get to the solutions, let's see how much help your knees actually need. I want you to look at this list of 5 common symptoms. Count how many of these you experience on a weekly basis. 1. Morning stiffness. Do your knees feel locked or tight for the first 15 minutes after you wake up? 2. The Rice Krispies sound. Do you hear a cracking, popping, or grinding noise, what we call crepitus, when you squat or walk? 3. The movie theater sign. Does your knee ache or throb after sitting for long periods, like in a car or a theater? 4. Weather sensitivity. Do you feel more pain right before a rainstorm or when the temperature drops? 5. Giving way. Do you ever feel like your knee is unstable or might buckle underneath you? How many did you get? Comment that number below. If you have even 2 of these, your body is sending you a distress signal. The root cause of these symptoms isn't just wear and tear. It's a combination of chronic inflammation, which is like an invisible fire burning away your joint lining, and oxidative stress, which you can think of as biological rust eating at your cells. To fix the knee, we have to put out the fire and scrub away the rust. The first food on our list is one you likely have in your pantry, but you're probably using it wrong. It's turmeric, specifically its active compound, curcumin. I remember a patient named Robert, 58. Robert was an avid golfer, but his knee inflammation was so bad he couldn't finish 9 holes. He was taking ibuprofen every single day, which was starting to tear up his stomach lining. We put him on a high bioavailability turmeric protocol. Within just 3 weeks, the swelling in his knees had visibly gone down, and he was back on the course without a single NSAID in his pocket. How does it work? Think of curcumin as your body's internal fire extinguisher. At a cellular level, it blocks a protein complex called NF-κB. This protein is the master switch for inflammation. When NF-κB is turned on, it tells your body to produce inflammatory cytokines that chew through cartilage. Curcumin flips that switch to off. A landmark study published in the Journal of Medicinal Food in 2016 performed a systematic review of randomized clinical trials. The researchers found that around 1,000 milligrams of curcumin a day was just as effective as ibuprofen for reducing joint pain and improving function, but without the dangerous side effects on the heart and gut. But here is the catch. Curcumin is notoriously hard for your body to absorb. To unlock its power, you must combine it with 2 things: black pepper, which contains piperine, and a healthy fat. The golden milk recipe: 1 teaspoon turmeric, a pinch of black pepper, and 1 teaspoon of coconut oil in warm almond milk. Golden time: drink this in the evening. It helps suppress the inflammatory surge that happens while you sleep, reducing that dreaded morning stiffness. Have any of you tried golden milk before? Did you notice a difference in your morning stiffness? Let me know in the comments. Next is a food that our ancestors used for centuries, but modern society has largely forgotten: slow-cooked bone broth. I once treated a young woman named Sarah, 34, who was struggling with postpartum joint pain. During pregnancy, her body produced a hormone called relaxin to loosen her joints, but months after birth, her knees still felt loose and painful. She started incorporating 10 ounces of homemade bone broth daily. Within a month, that wobbly feeling disappeared, and her knees felt stable and strong again. Think of bone broth as the biological scaffolding for your joints. Your cartilage is primarily made of type 2 collagen. When you simmer bones for 24 hours, you release type 2 collagen, glucosamine, and chondroitin into a liquid form that your body can easily recognize and use to patch up the holes in your cartilage. A study in the journal Current Medical Research and Opinion followed athletes with activity-related joint pain. Those who supplemented with collagen, the primary ingredient in bone broth, for 24 weeks showed significant improvement in joint pain during walking and even at rest compared to the placebo group. Don't buy the stock from the grocery store aisle. That's mostly water and salt. You want real bone broth that gels when it gets cold. The recipe: use grass-fed beef bones or organic chicken carcasses. Add 2 tablespoons of apple cider vinegar. This is crucial. It acts like a magnet to pull the minerals out of the bones. Golden time: drink 1 cup at noon to provide your body with the building blocks it needs for afternoon activity. Note: always ensure you have enough vitamin C, like a squeeze of lemon, with your broth, as vitamin C is the glue that helps your body knit that collagen together. Do you make your own broth, or do you find it too time-consuming? If you want my shortcut slow cooker recipe, let me know. This third one is often controversial because of the smell, but its power is undeniable. I'm talking about sardines and other fatty fish high in omega-3s. James, 62, was an office worker who sat for 9 hours a day. His knees felt like they were drying out. Every time he stood up, he heard a loud crack. He hated the idea of fish, but he hated the pain more. He started eating sardines 3 times a week. After about a month, he told me his knees felt oiled. The grinding sound was almost gone. We call omega-3 fatty acids the joint lubricant. Inside your knee is a fluid called synovial fluid. Think of this like the engine oil for your joints. Omega-3s help maintain the quality of this oil, making it slippery and protective. Furthermore, they produce molecules called resolvins that actively resolve inflammation rather than just masking it. The American Journal of Clinical Nutrition published research showing that individuals with higher intakes of omega-3 fatty acids had significantly lower levels of inflammatory markers like C-reactive protein, CRP, and less cartilage loss over a 2-year period. You need about 2,000 milligrams of EPA/DHA daily for therapeutic joint effects. The guide: 3 servings of sardines or wild-caught salmon per week. Note: if you can't stand the taste, look for a high-quality, third-party tested fish oil. Avoid soybean oil or vegetable oils in your canned fish, as these are pro-inflammatory and will cancel out the benefits. Are you a fan of sardines, or do you find them too fishy? Be honest. Finally, we have a vibrant vegetable that most people associate with vitamin C, but few realize its role in joint health: the red bell pepper. Linda, 55, had what I call fragile joints. She bruised easily and her knees felt thin. We added a daily dose of raw red bell peppers to her lunch. In 6 weeks, not only did her knee stability improve, but she noticed her skin looked firmer. Why? Because the same glue that holds your skin together holds your cartilage together. I call vitamin C the collagen glue. You can eat all the bone broth and collagen in the world, but without vitamin C, your body cannot cross-link those proteins. It's like trying to build a brick wall without any mortar. Red bell peppers actually have triple the vitamin C of an orange. A study published in the Annals of the Rheumatic Diseases found that people with the lowest intake of vitamin C were 3 times more likely to develop inflammatory arthritis than those with the highest intake. The guide: eat half a raw red bell pepper daily. Important: heat destroys vitamin C. To get the collagen glue effect, you must eat them raw or very lightly steamed. Combination: eat these with your food number 2, bone broth, to maximize the brick and mortar effect. What's your favorite way to eat peppers? I like mine sliced with a little bit of hummus for a crunch. Let's summarize. To save your knee cartilage: 1. Turmeric plus pepper to put out the fire. 2. Bone broth to provide the scaffolding. 3. Sardines to lubricate the hinge. 4. Red bell peppers to provide the glue. Remember, Margaret didn't get better overnight. It took consistency. If you provide your body with the right biological information through your food, it knows what to do. My final advice: don't wait until the pain is unbearable. Start feeding your joints today. Even if you only pick one of these foods to start with, you are moving in the right direction. If you found this helpful, please subscribe to the channel and hit the notification bell. In our next video, we are going to talk about the 3 silent morning habits that are actually destroying your joint health without you knowing it. I'm Dr. David Thompson. Stay healthy, stay independent, and I'll see you in the next one.